Today's training will focus on prompting and prompt use in ABA practice, with an emphasis on what RBTs need to know to use prompts effectively, ethically, and consistently. We'll begin by reviewing the training length, the target audience, and the learning objectives, so everyone knows what to expect from this session. Next, we'll go over the suggested agenda and then move into the core content for the training, where we'll define prompting, discuss why prompts are used, and review how prompts support skill acquisition while reducing errors. From there, we'll cover the types of prompts, including common examples RBTs may use during instruction. We'll then discuss prompt hierarchies, or the order in which prompts are arranged from more intrusive to less intrusive, depending on the learner's needs and the teaching plan. After that, we'll review prompt fading, which is the process of gradually removing prompts to promote independence, followed by the transfer of stimulus control, where the learner begins responding correctly to the natural instruction or cue rather than relying on the prompt. We'll also address prompt dependency, including what it is, how it develops, and how RBTs can help prevent it during teaching sessions. Finally, we'll end with best practices for RBTs and several practice scenarios to help apply these concepts to real clinical situations. By the end of this training, you should have a clear understanding of how to use prompts correctly, when to fade them, and how to support learner independence in a way that is both effective and consistent with the treatment plan. The total duration of this training session is set to be 60 minutes. That means for those of you who are acquiring CPUs, this will count as one CPU. Note that this training is specifically meant for registered behavior technicians and those wanting to earn CPUs. If you are a BCBA, note that this will not count as a continued education unit. Now that we've looked at the overview, let's talk about what you should be able to do by the end of this training. The goal here is not just to give you information, but to make sure you actually apply prompting strategies confidently and correctly in your sessions. First, you should be able to define prompting and explain its purpose in ABA. Prompting is a core teaching strategy we use to help learners acquire new skills while reducing errors. By the end of this training, you should be able to clearly explain what a prompt is and why we use it, not just follow directions, but truly understand the why behind it. Next, you'll be able to identify different types of prompts. This includes things like verbal, gestural, model, and physical prompts. You'll learn how these look in real sessions and how to recognize which type you're using in the moment, which is really important to accurately implement information and data collection. You'll also learn how to distinguish between different prompt hierarchies. Not all prompting strategies are the same, and the order we use prompts matters. By the end of this training, you should be able to recognize whether a program is using something like most to least or least to most prompting, and understand why that choice was made. Another goal is being able to describe and implement prompt fading. Remember, prompting is not the end goal, independence is. So, you'll learn how to gradually reduce prompts in a way that supports success without creating reliance. This connects directly to transfer of stimulus control, which is a big concept in ABA. By the end of this training, you should understand how we move from the learner responding to a prompt to responding to the natural instruction or environment instead. We'll also make sure you can recognize prompt dependence. This is when a learner becomes overly reliant on prompts, and it can be unintentionally done. You'll learn how to look for and how your actions as an RBT can either contribute to or prevent this issue. Finally, you'll be expected to implement basic error correction and prompt fading strategies in a way that aligns with the treatment plan. This means responding appropriately when a learner makes an error and using prompting in a way that supports learning, not just getting the correct answer in the moment. Overall, by the end of this training, the expectation is that you're not just going to use prompts, you're using them intentionally, systematically,
and with the goal of independence in mind. That's really what separates a technician who is just following steps from one who is practicing at a high level.
In these first 5 minutes, we'll look at the introduction and purpose. This includes an explanation of prompting, its importance, and risks of improper use during ABA interventions. Next, we'll go into an overview of physical prompts, partial physical prompts, modeling, gestural, visual, verbal, and positional and environmental prompts. We'll discuss most to least prompting, least to most prompting, time delay, and graduated guidance prompt hierarchies. We'll then discuss prompt fading and transfer of stimulus control. This includes an explanation of what prompt fading is, including moving towards independent responding and avoiding prompt dependency overall. Next, we'll take a deeper look at prompt dependency, including identification of errors such as prompting too soon, repeating prompts, slow fading, and inconsistent implementation. We'll wrap up by looking at practice scenarios, including the application of the knowledge you've learned in this training to actual client situations. This can help you apply all the strategies you've used today, not just learning, but implementing. A quick quiz or discussion will consolidate our learning at the end of this training. Please note that this does not consist of the quiz that's for this training to earn the CPU. You will need to do that after the training is complete. The core of this training is about prompting, so it's really important that we start out with understanding what a prompt is. A prompt is a cue or assistance to help a learner respond correctly, supporting skill acquisition towards independence. So why do we use prompts? We use prompts to increase correct responses, reduce errors, support skill building, and prevent frustration, as well as maintaining teaching momentum. Note that prompts are temporary supports, but the ultimate goal is independent responding. Now we're going to move into one of the most important parts of this training, types of prompts. As RBTs, prompting is something you will use constantly throughout your sessions. Whether you realize it or not, almost every time you help a learner respond correctly, you are using some form of a prompt. At a basic level, prompts are extra cues or assistants that help a learner engage in the correct response. The goal is to increase success and reduce errors while a skill is still being learned. There are two main categories of prompts that we're going to focus on today: response prompts and stimulus prompts. Understanding the difference between these two is really important because they function in different ways and are used for different teaching purposes. As we go through each type, I want you to think about your own sessions, what prompts you already use, and whether you're using them intentionally or just out of habit. The goal here is to become more aware and strategic in your prompting. Let's start with response prompts. Response prompts are exactly what they sound like. They are prompts that act directly on the learner to help them perform the correct response. In other words, you are assisting the learner's behavior itself. These include physical prompts, like hand-over-hand guidance, partial physical prompts, guiding part of the movement, model prompts, showing the learner what to do, verbal prompts, telling the learner what to say or do, gestural prompts, pointing or indicating the correct response. All of these involve you, the therapist, doing something that helps the learner respond correctly. Let's look at a quick example. If you say, "clap your hands," and the learner doesn't respond, if you clap your own hands, that's a model prompt. If you physically guide their hands, it's a physical prompt. If you say, "do this," while demonstrating that's a combined verbal and model prompt. So again, response prompts are about helping the learner perform the behavior. Now, here's something really important. Response prompts are often the most effective for early skill acquisition because they ensure the learner is contacting reinforcement for the correct response. But they also come with a risk, prompt dependence, if we don't fade them properly. So, when using response prompts, always ask yourself, am I using the least amount of help needed? Do I have a plan to fade this? Because the goal is not just correct responding, it's independent responding. Now let's talk about stimulus prompts, which are a little different. Instead of helping the learner perform the response, stimulus prompts involve changing something about the environment or materials to make the correct answer more obvious. So, rather than guiding the learner directly, you're guiding their attention. Examples of stimulus prompts include highlighting or underlining the correct answer, placing the correct item closer to the learner, making the correct choice larger or more visually prominent, using color cues or visual supports. Let's look at an example. If you're teaching a learner to identify the letter A from an array, if you point to the A, that's actually a gestural response prompt. But if you make the A bigger or brighter than the others, that's a stimulus prompt. Another example. If you're teaching a learner to choose the correct item from a field of 3, moving the correct item closer to them is a stimulus prompt. Physically guiding their hand to it is a response prompt. So, the key difference is, response prompts, you help the learner do the behavior, versus stimulus prompts, you change the environment to make the correct response more likely. Stimulus prompts are often less intrusive and can be really helpful when we want to promote independence while still supporting success. However, they still need to be faded, just like response prompts. Otherwise, the learner may only respond correctly when those extra cues are present. So to bring this all together, we have two main categories of prompts: response prompts, where you directly assist the learner, and stimulus prompts, where you modify the environment. Both are valuable tools and both have their place in teaching. As an RBT, your job is not just to use prompts, but to use them intentionally, consistently with the treatment plan, and always with the goal of fading towards independence. As we move into the next section, we're going to build on this and talk about prompt hierarchies, which will help you understand how to organize and sequence these prompts effectively. And that's where everything really starts to come together in practice. Now that we understand types of prompts, let's talk about how we actually use them in a structured way, which is where prompt hierarchies come in. We're going to start with most to least prompting. Most to least means you begin with the highest level of support and then gradually reduce that support over time. So we're starting with a level of prompting that guarantees success and then fading from there. What this looks like. Let's say you're teaching a new skill, like brushing teeth. You might start with a full physical prompt and guiding the entire emotion. Then move to partial physical, then model, then gestural, then independent responding. So the support is decreasing over time. How about when do we use this? Most to least is best when the skill is brand new. The learner has no prior experience. There is a high chance of errors, or errors would be problematic or unsafe. Why does most to least work? This approach works because the learner is almost always successful. They contact reinforcement consistently. It reduces frustration and problem behavior. So, can anyone give me an example of a skill where you'd want to start with full support? Some common answers include hand washing, using utensils, safety skills. But here's a caution. The biggest mistake with most to least is not fading quickly enough. If you stay at full physical too long, you risk prompt dependence, reduced independence. So always be thinking, when can I step back? Now let's flip this and talk about least to most prompting. This is the opposite approach. Instead of starting with maximum support, you start with little to no prompting and only increase support if needed. So what does this look like? You give the instruction, touch your nose, then wait briefly. If no response, give a gestural prompt. Still no response, give a model prompt. Still no response, give a physical prompt. So the support is increasing only as needed. When do we use this? Least to most is best when the learner already has some familiarity with the skill. You want to test independence, or errors are okay and part of learning. Why does it work? This approach encourages independent responding first. It helps you see what the learner can do without help, and it prevents unnecessary prompting. Here's a question for you. Why might least to most be a better choice for a skill a learner already knows? Exactly, because we don't want to overprompt and accidentally teach them to rely on help they don't need. Here's a key caution. The biggest risk here is waiting too long to prompt. If the learner sits there confused or starts engaging in problem behavior, we've waited too long. So it's about finding the balance. Give a chance for independence, but don't let errors pile up. Next, we have time delay, which is one of the most powerful and practical strategies you'll use as an RBT. Time delay is exactly what it sounds like. You wait before giving a prompt. What does it look like? You give an instruction, clap your hands. Then you pause for a few seconds. If the learner responds, great, reinforce. If not, then provide a prompt. Why does this matter? This is huge for promoting independence because lots of times learners can respond. They just need a moment to process. If we jump in too quickly, we interrupt independent responding and create prompt dependence. There are two types of time delay. A constant time delay, always wait the same amount, like 3 seconds, or a progressive time delay, gradually increase the wait time. Be honest, how many of you feel like you might prompt too quickly sometimes? That's very common. Silence can feel uncomfortable, but it's actually where learning happens. Here's your key takeaway. Your wait time is an opportunity for independence. Even 2 to 3 seconds makes a very big difference. Finally, we have graduated guidance, which is often used with physical prompting. This is a little different from others. Graduated guidance means you are providing physical support, but adjusting it moment to moment, based on the learner's performance. What does this look like? Instead of a full physical prompt, then stopping, you start with full physical, then lighten your touch as the learner starts to take over. So you're constantly adjusting in real time. Here's an example. When you're teaching washing hands, you guide their hands under the water, then reduce pressure, then just hover nearby, then remove support completely. When do we use graduated guidance? Graduated guidance is best for motor skills, chain tasks, and skills that require a fluid movement. Why does it work? It allows for immediate success, smooth fading, and less rigid prompting. Here's your key caution. You have to be very aware of how much support you're giving and whether the learner is actually initiating movement. Otherwise, you can accidentally do too much for them. Let's tie this all together. In this section, we covered 4 major prompting strategies. Most to least prompting, where you start with high support and fade down. Least to most prompting, you start with independence and add support as needed. Time delay, pause before prompting. And graduated guidance, adjusting physical support in real time. Each of these serves a different purpose, and as an RBT, your job is to follow the treatment plan, understand why a strategy is being used, and implement it with consistency. If you think about your current sessions, which of these do you use the most, and which one do you think you could improve on? That reflection is what helps you grow from just doing a job to doing it really well. Next, we're going to build on this and talk about prompt fading and transfer stimulus control, which is where all of this leads. Because remember, the end goal is always independence. Now we're moving into one of the most important concepts in this entire training, prompt fading. If you remember nothing else from today, remember this. The goal of prompting is not correct responding. It's independent responding. Prompts are just a temporary support system. They help the learner be successful while they're learning a skill, but they're not meant to stay forever. So, prompt fading is the process of gradually removing these supports so that the learner can respond independently. Why does this matter? If we don't fade prompts, learners can become prompt dependent. They may only respond when help is given, and they may struggle to generalize skills across settings. On the other hand, when we fade correctly, learners become more independent, skills become more functional, and learning becomes more natural. So prompt fading is really what bridges the gap between. They can do it with help versus they can do it on their own. As RBTs, you should always be asking yourself, how can I help less? When can I step back? Is this learner ready for more independence? Because fading is not something we do at the end. It should be happening throughout teaching. Let's break down what prompt fading actually looks like in practice. Prompt fading is systematically reducing the level of assistance provided to the learner over time. There are several ways we can do this, and you'll likely use a combination depending on the skills of the learner. First, we have reducing physical prompts. One of the most common examples is with physical prompting. You might start with full physical guidance, then fade to partial physical, then a light touch, then no physical support at all. So you're gradually doing less and less. Next, we have fading verbal prompts. Verbal prompts are tricky because they're easy to overuse. For an example, instead of saying, say ball, you might fade to ball, then eventually remove the prompt entirely. Or instead of repeating the full instruction multiple times, you reduce how many times you say it. Fading model prompts is next. If you're demonstrating a behavior, you might start with a full model, then a partial model, then just a gesture, then nothing. Again, it's about gradually removing support. Fading stimulus prompts. This includes things like making a correct answer less obvious over time, returning items to equal size or position, removing highlights or visual cues, so the learner is no longer relying on those extra environmental supports. Using a time delay. Another powerful way to fade prompts is waiting longer before helping. Instead of prompting immediately, you pause, give the learner a chance to respond, then only prompt if needed. This naturally encourages independence. I want you to think about your sessions. Have you ever caught yourself jumping in too quickly to help? That's very common, but every time we jump in too fast, we may be taking away an opportunity for independent responding. The key concept here is transfer of control. What you're really doing with prompt fading is something we call transfer of stimulus control. That means the learner stops responding to the prompt and starts responding to the natural instruction or environment. For an example, instead of responding because you said touch your head and pointed, they respond just because you said touch your head. That's the goal. Here's some common mistakes to avoid. Fading too slowly. This leads to prompt dependence. Fading too quickly. This leads to errors and frustration. Inconsistent fading. This can confuse the learner. Prompting too soon prevents learner independence. Here's a clinical tip. Follow the treatment plan, but also stay observant. If a learner is consistently successful, that's your signal to start fading. If they're struggling, you may need to temporarily increase support. It's a balance. To summarize, prompt fading is about systematically reducing supports so that learners can respond independently. We can fade physical prompts, verbal prompts, model prompts, stimulus prompts, and timing of prompts. And throughout all of this, the goal is independence and natural responding. As you go back into your sessions, I want you to ask yourself, am I helping because it's needed or because it's habit? That awareness is what turns good prompting into great teaching. All right, now we're going to move into one of the most important concepts in ABA teaching, transfer of stimulus control. At its core, this is what separates prompt-dependent learners from independent learners. When we first teach a skill, we usually rely on prompts. That might be verbal prompts, gestures, modeling, or even physical guidance. These prompts help the learner give the correct response. But here's the key. Prompts are not the end goal. Our goal is for the learner to respond correctly to the natural cue, not to us. So what is stimulus control? Stimulus control means that a behavior is happening because of a specific cue or instruction. For an example, if I say, touch your head, and the learner touches their head, that instruction is controlling the behavior. If I don't say anything and they don't respond, that's appropriate stimulus control. Now, here's where things can go wrong. If a learner only responds when you say, touch your head like this, and we model it every time, then the model and not the instruction is controlling the behavior. That's what we call prompt dependence. And prompt dependence is something we always want to avoid. So what do we do instead? We intentionally transfer control from the prompt to the natural stimulus. That means, at first, the prompt helps them get it right. Then we gradually fade that prompt until the learner responds independently to the instruction alone. Let me give you a few simple examples. Imagine you're teaching a child to say ball. At first you might say ball, and then immediately model ball. They repeat it. Great. But if we always model, they may wait for you every single time. So instead, we start to fade that prompt. We pause before modeling. Say ball, ball. We give them a chance to respond. We might use a partial prompt instead of a full one. Say ball, ball. Eventually, we remove the prompt completely. Now the word ball happens because they see the ball or hear the instruction, not because we told them exactly what to say. That's stimulus control. Now let's talk about why this matters so much in real life. If we don't transfer stimulus control, learners may only perform skills during therapy. They may rely heavily on adults, and skills won't generalize to home, school, or community settings. But when we do transfer stimulus control, learners become more independent, skills become more functional, and they can use what they've learned in real-world situations. As RBTs, your role is critical here. You're the one delivering prompts, watching for prompt dependence, fading prompts at the right time, giving opportunities for independence. And one important reminder here, don't fade too fast, but don't stay too long either. There's a balance. If we fade too quickly, the learner may start making errors. If we fade too slowly, they become prompt dependent. So we're always watching. Are they ready for less help? Are they starting to anticipate the prompt? Can I give them a chance to try on their own? That decision-making is where your clinical skills really develop. All right, now let's look at what this actually looks like in practice. Let's break this down with a concrete example so you can really see what transfer of stimulus control looks like during a session. On this slide, we're showing a learner shifting from response to prompts to responding to natural cues independently. Let's walk through a scenario. Imagine you're teaching a learner to identify a picture of a dog. At the very beginning, you might say, "Touch dog," and then immediately point to the correct picture. That pointing is your prompt. The learner touches the dog. Great, we reinforce. But remember, the goal is not for them to follow your point. The goal is for them to respond to the instruction, touch dog. So what do we do next? We start to fade the prompt. Step 1. Instead of pointing right away, we pause for a second. We give them a chance to respond independently. If they don't respond, then we prompt. Step 2. We make the prompt less obvious. Maybe instead of a full point, we use a smaller gesture or move our hand closer without directly pointing. Step 3. We remove the prompt completely. Now when we say touch dog, the learner responds correctly without any extra help. That's successful transfer of stimulus control. So let's talk about something really important now. Error correction during this process. If the learner makes a mistake when we start fading prompts, it's okay. It's part of learning. But we don't just ignore it. We interrupt the error, repeat the instruction, provide the correct level of prompt, then give them another chance. This ensures they're still practicing the correct response. This is also consistent with the model prompt switch repeat method. Now let's connect this to your day-to-day work. You might notice things like a learner waiting and looking at you before responding, a learner only responding after you repeat the instruction, a learner relying on the same type of prompt every time. These are all signs that stimulus control has not fully transferred yet, and that's your cue to adjust. Increase your wait time, fade prompts more intentionally, or mix in independent trials. Also, don't forget to reinforce. Independence has to be reinforced more strongly. Independent responses should get more enthusiastic praise, possibly stronger reinforcers, because we want the learner to contact more reinforcement for doing it on their own. Let's look at one more quick real-life example. Teaching a child to wash their hands. At first, you might guide them step by step, but over time, you stop giving instructions. You let the sink, soap, and routine become the cues. Eventually, they walk into the bathroom and wash their hands independently. That's the goal. So to summarize, transfer of stimulus control means moving from prompted responding to independent responding under natural conditions. And everything we do, prompting, fading, reinforcing, is aimed at that end result. As an RBT, if you keep the goal in mind, your teaching will always stay on track. All right, next we'll build on this and look at specific prompting and fading strategies you'll be using. Now that we understand transfer stimulus control, we're going to talk about what happens when that process doesn't go well. This is called prompt dependence. Prompt dependence happens when a learner becomes reliant on prompts and is unable to respond independently. So instead of the behavior being controlled by the instruction or environment, it's controlled by you. And I want you to really hear this. If a learner is prompt dependent, they are not truly learning the skill in a functional way. They are learning how to respond to you, not how to function in their everyday environment. Let's make this really concrete. A prompt-dependent learner might wait for you to repeat the instruction, look at you before responding, only respond after you gesture, model, or guide, and perform perfectly during sessions, but not anywhere else. So it can look like they know the skill, but the moment you step back, the skill disappears. That's prompt dependence. Here's a real-life example. You're teaching a child to answer, "What color is this?" Every time you say, "What color is this?" say blue. The learner says, "Blue." Great. But what happens next time? They wait, because they've learned, I don't answer until the adult tells me what to say. So now the prompt controls the response, not the question. That's prompt dependence. Why does this happen? Here's the thing. This doesn't happen because the learner is being difficult. It happens because of how we teach. Prompt dependence is almost always accidentally taught, which means we can also fix it. Let me ask you all something. Think about your current clients. Do you have anyone who waits and looks at you before responding? Maybe someone who does great with prompts but struggles independently? Or someone who seems like they know it but only during sessions? That's prompt dependence. And recognizing it is the first step. This matters because prompt dependence limits independence, prevents generalization, and slows progress. It can make learners dependent on adults long term. And in ABA, our goal is always independence and functional skills. So anytime you see prompt dependence, we need to shift our approach. Let's break this down further and look at how to actually identify prompt dependence in your sessions. Now we're going to focus on what prompt dependence actually looks like during a session, because if we can't identify it, you can't fix it. The key sign here is the learner relies on staff cues before responding and performs poorly without prompts. Let's unpack that. A prompt-dependent learner often waits before responding, looks at you for reassurance, and responds right after a prompt but not before, or performs inconsistently when prompts are removed. So you might see 100% accuracy with prompts, 20 to 40% accuracy without prompts. That gap is a huge red flag. Here's some examples. Let's say you're running a DTT trial. You say, touch nose, the learner pauses, looks at you, and doesn't respond. Then you model it, and suddenly they do it perfectly. That tells us the instruction is not controlling the behavior, the prompt is. Some more subtle signs that you might notice is watching out for learners starting to move only when you lean forward, responding after you slightly gesture, waiting for tone changes in your voice, and even small unintentional cues like this can become prompts. I want you to think for a second. What are some prompts you might be giving without realizing it? Eye gaze, body positioning, repeating instructions, and saying the first sound of a word can all count as minor prompts that can also lead to prompt dependence. These can all create prompt dependence if you're not careful. Here's a big takeaway. If the learner needs you to respond, stimulus control has not been transferred, and that's our signal to increase independent opportunities, fade prompts more intentionally, and adjust our teaching. So now that we know what prompt dependence is and how to spot it, let's talk about the most important question. Why does it happen? This is where things get really important, because this is where we come in. Prompt dependence is not random. It is almost always caused by instructional errors. Let's go through the main causes listed on this slide. Prompting too quickly. This is one of the biggest ones. If we prompt immediately after giving an instruction, the learner never has a chance to respond independently. So they learn, I don't need to think, the answer's coming. Instead, you should pause, give wait time, allow processing, and even 2 to 3 seconds can make a huge difference. Overusing prompts. If we always prompt, the learner becomes dependent on it. For an example, every trial includes a model. The learner learns to wait for the model. Instead, we should mix prompted and independent trials and fade prompts as soon as possible. Lack of fading. This is a big clinical issue. If we introduce a prompt but never systematically fade it, that prompt becomes more permanent. Prompting without fading is one of the fastest ways to create prompt dependence. Reinforcing prompted responses equally. This one's huge. If we give the same level of reinforcement for independent responses and prompted responses, then the learner has no reason to try independently. So what do? We reinforce independence more strongly. This might look like bigger praise, better reinforcers, more excitement. We want independence to be worth it. Inconsistent application. If one therapist fades prompts but another doesn't, or one person gives wait time and another prompts immediately, the learner gets mixed signals. Consistency across staff is critical. Let's tie this together. You're teaching a learner to label dog. If you prompt immediately, always model, never fade, reinforce prompted responses equally, then what happens? The learner waits for you every time. But if you pause, fade prompts gradually, reinforce independence more, and stay consistent, you build independence. I want you to remember this. Prompt dependence is not a learner problem, it's a teaching problem. And that's actually good news because it means you have the power to fix it. Next, we're going to look at how to fix prompt dependence using specific prompting and fading strategies you can apply immediately in your sessions. All right, now that we've talked about prompt dependence, we're going to move into the solution side of things. And that starts with something called a prompt hierarchy. Prompt hierarchy is simple, a structured order of prompts ranging from least intrusive to most intrusive. This helps us teach effectively, support correct responding, and systematically fading prompts. Without a hierarchy, prompting becomes inconsistent, reactive, and based on guessing. But with a hierarchy, we are intentional. We know where to start, where to increase supports, and when to fade supports. Let's quickly review some common prompts from least to most intrusive. Independent, with no prompt. A gestural prompt, pointing or looking. Verbal prompts, hints and partial words. Model prompts, showing the correct response. And physical prompts, guiding the learner. The more intrusive the prompt, the more it helps, but also the more it risks dependence. Here's the balance we're always trying to hit. Use enough support to ensure success, but not so much that we create dependence. I want you to think about your current clients. Do you tend to jump in too quickly with help, or wait too long and let errors happen? Most people lean one way or the other. Our goal is to be intentional and balanced. There are two main ways we use prompt hierarchies in teaching: least to most prompting and most to least prompting. Both are effective, but they are used in different situations. Let's break them down some more. Let's start with least to most prompting. This approach means we start with the least amount of help and only increase support if needed. What this looks like is in step 1, we give the instruction, touch your head, then we wait. This wait time is critical. We're giving the learner a chance to respond independently. If no response or an incorrect response is given, then we move up the hierarchy. Start with a gestural prompt, then maybe a verbal hint, then a model, then physical guidance if needed. We only increase support as necessary. Why do we use least to most? This method is great for skills the learner is already somewhat familiar with, promoting independence, avoiding prompt dependence, because we always give them the first opportunity to respond on their own. Here's an example. Let's say we're teaching clap hands. Trial 1, you say it and wait. If they don't respond, you model clapping. If still no response, you guide them physically, then reinforce. The most important part of least to most is wait time. If we don't wait, you're not doing least to most. You're just prompting immediately. Some common mistakes that we see are asking the question and then prompting right away. That completely removes the opportunity for independence. I want you to think, how long do you typically wait after giving an instruction? 1 second, 2 seconds, no wait time at all? Aim for about 2 to 3 seconds unless otherwise specified. When do we not use least to most? Least to most is not ideal when the learner is brand new to the skill. The learner is likely to make repeated errors, and errors could be reinforcing. In those cases, we use something different. This brings us to our next strategy, most to least prompting. Most to least prompting is the opposite approach. Instead of starting with minimal help, we start with the highest level of support needed to ensure success. What does this look like? Step 1, we give the instruction, touch your head, immediately followed with a strong prompt like a model or physical guidance, so the learner gets it correct right away. Then what do? Over time, we fade the prompt. So it might look like a full physical to a partial physical, a model to a gesture to independent responding. Most to least is best for new skills, learners who need high support, and situations where we want to avoid errors, because it ensures the highest rate of success and strong learning history. Here's an example. If we're teaching wave, at first you physically guide the wave. Then the next trial you reduce physical supports, then a model, then gesture, then an independent response for waving. Most to least is about errorless learning. We want to prevent the learner from practicing incorrect responses. A big mistake here is staying at the highest prompt for too long. If we never fade, we create prompt dependence. Think about your learners. Who might benefit from most to least? Typically, early learners, learners acquiring new targets, and learners with frequent errors are great candidates for most to least intrusive prompting. Let's do a quick comparison. In most to least prompting, you start with full support. You fade prompts over time, and it's best used for new skills. Least to most prompting, on the other hand, starts with independence, increases prompts as needed, and it's best for known skills. I want you to remember this. Prompting is not just what you do, it's how you think. You're constantly deciding how much help is needed, when to give it, when to remove it, and those decisions directly impact whether your learner becomes independent. Next, let's take a look at and talk about some best practice guidelines for RBTs when it comes to prompts and prompt dependency. All right, now that we're going to bring everything together, we've talked about transfer stimulus control, prompt dependence, prompt hierarchies, least to most, and most to least prompting. Now the question becomes, what does this actually look like for you as an RBT during a session? Because at the end of the day, this isn't just theory, this is what you're doing moment to moment with your learners. I want you to think of prompting as a constant decision-making process. You are always asking yourself, how much help does my learner need right now? Can they do this independently? Am I helping too much? Am I not helping enough? That's the skill. As an RBT, your role is not just to get correct responses. Your role is to build independence responding. That means not jumping in too quickly, not staying on prompts too long, and watching your learner closely. Let's say you're running a program. Point to the apple. You give the instruction. Now you have a decision to make. Do you wait? Do you prompt immediately? Do you give a gesture? This is where your training comes in. The difference between a strong RBT and an average one is this. A strong RBT is intentional with prompting, not automatic and not rushed. I want you to think about your own sessions. Have you ever prompted right away without thinking? Repeated the instruction multiple times? Or helped because silence felt uncomfortable? That's normal, but it's exactly what we're working on to improve. So let's break this down into very clear, actionable guidelines you can follow every day. Here we have some core guidelines for effective prompting. We're going to go through each one, and we'll explain what it actually looks like in practice. First, follow the treatment plan. This is always your first priority. The BCBA designed the prompting strategies for a reason. So if the plan says use least to most, use most to least, use specific prompt levels, follow it exactly. If something isn't working, your role is not to change it on your own. It's to communicate with your supervisor. 2. Use least intrusive prompts first, when appropriate. When possible, we want to start with the least amount of help needed, because independence is the goal. But remember, this depends on the program. If it's a new skill, you may be using most to least instead. So always match your prompting to the learner, the skill, and the treatment plan. 3. Fade prompts appropriately. This is one of the most important skills you will develop. Fading means gradually reducing supports over time. For an example, moving from a full physical to a partial physical, moving from a model to a gesture, moving from an immediate prompt to a delayed prompt. If we don't fade, we create prompt dependence. 4. Reinforce independence more. This is huge. If a learner gets it right independently, big reinforcement. If they need a prompt, still reinforce, but less enthusiastically. We want the learner to learn. Do it on my own gets me better outcomes. 5. Track prompt levels. This is something that we often overlook. You should always be aware of how much prompting you're using, because if you're not tracking it, even mentally, we can't fade effectively or report progress accurately. 6. Avoid extra prompts. This is a big one. Extra prompts include things like repeating instructions unnecessarily, changing your tone to hint at the answer, leaning towards the correct response, or giving unplanned cues. These may seem small, but they can create prompt dependence very quickly. 7. Give wait time. This might be the hardest skill for many RBTs. After giving an instruction, wait. Give the learner time to process. Silence can feel uncomfortable, but it's necessary for independence. Consult supervisor when unsure. You're not expected to figure everything out alone. If you're noticing prompt dependence, a lack of progress, or confusion about prompting, bring it to your BCBA. That's exactly what supervision is for. Number 9, be consistent. Consistency across sessions and staff is critical. If one person fades prompts and another prompts immediately, the learner will struggle. Consistency creates clear expectations and faster learning. To wrap it up, I want to leave you with this. Prompting is not just about helping, it's about how you help and when you stop helping. Every time you prompt, ask yourself, am I moving this learner closer to independence or further away from it? Because that's the goal of everything we do. Next, we'll apply these best practices in real scenarios so you can feel confident using them during your sessions. All right, now we're going to put everything together. Up to this point, we've covered prompt dependence, prompt hierarchies, least to most prompting, most to least prompting, best practices. But here's the truth. You don't learn prompting by hearing about it. You learn it by doing it. So for this section, we're going to walk through real scenarios. I want you to think like this the entire time. What would I do in this moment? Why would I choose that strategy? What mistakes could I make here? There are no trick questions, but there are definitely better and worse clinical decisions. And this is exactly how your BCBA is thinking when they observe you. As we go through each scenario, I'll read it, I'll pause and let you think, then we'll walk through the correct approach step by step. If you want, you can even jot down your answer before I explain it. Let's start with scenario 1. Teaching point to cat using most to least prompting with model, gesture, or physical prompts and fading support across trials. All right, here's the situation. We're teaching a learner to point to cat. We are using most to least prompting. My first question for you, why are we using most to least here? We're using most to least because this is likely a new skill. We want to ensure success right away, and we want to avoid repeating errors, so we're starting with high support. Let's walk through what a correct trial should look like. For our first trial, you say, touch cat, and immediately you provide a model prompt or possibly physical guidance to touch the cat. The learner responds correctly, and you reinforce. Now here's the key question. What do you do on the next trial? Do you A, do the exact same prompt again, B, reduce the prompt, or C, wait and see what happens? The correct answer is reduce the prompt, because it's most to least. We are always working towards fading. So progression might look something like this. Trial 1, we use a full model or physical. Trial 2, we use a partial model. Trial 3, we use a gesture. Trial 4, we see an independent opportunity. A very common mistake is staying at the same prompt level for too long. If you keep modeling every time, you're creating prompt dependence. What I would say during supervision is you're getting great responding, but we need to start fading that prompt so they don't rely on it. Let's say the learner gets it wrong when you fade. What should you do? Go back up the hierarchy briefly, then try fading again. We don't stay at the higher prompt, we just use it as a support. So your takeaway for this scenario, in most to least intrusive prompting, we start strong, then we fade quickly and intentionally. In this scenario, a learner is placing shoes away with some distraction. Use least to most prompting, starting with instruction only, adding prompt as needed, then fading. In scenario 2, the learner is supposed to put their shoes away, but they're distracted. We're using least to most prompting. My first question for you, why are we using least to most here? Because this is likely a known or partially learned skill, we want to promote independence first, or we want to avoid unnecessary prompting. Let's walk through the trial. You give the instruction, put your shoes away. Now what? You wait. This is the most important part. If the learner doesn't respond or is distracted, then we move up the hierarchy. Prompt progression might look like this. You give the instruction and wait. You gesture by pointing to the shoes or the bin. You give a verbal reminder, shoes go here. You model, or you provide physical guidance if needed. We only prompt as much as needed, not more. The most common mistake here is prompting too quickly. If you say, put your shoes away, and immediately point, you skipped independence. How many of you feel uncomfortable with silence? That discomfort often leads to overprompting, but that silence is where learning happens. Once the learner starts responding, we fade back down. So next time we use less prompting and we see more independence. Your takeaway for this scenario is least to most prompting. Give independence first, then support only as needed. Here's our final scenario. In this scenario, the learner waits for prompts despite knowing the skill, indicating prompt dependence. We fix by increasing delays, reducing prompts, and reinforcing independence. The learner knows the skill, but waits for prompts. What does this tell us? This is called prompt dependence. The learner has learned, I wait for help before responding. So now our goal is not teaching the skill, it's fixing stimulus control. What do we change? We adjust by increasing wait time, reducing prompts, and reinforcing independence more. Let's walk through an example. You say, touch nose, then you wait longer than usual, even if it feels uncomfortable. If they respond independently, big reinforcement. This is the behavior we want. If they don't respond, then provide the least intrusive prompt possible, not the biggest one. We're trying to break the pattern of wait, get prompt, respond, and replace it with hear instruction, respond independently. A big mistake here is continuing to prompt the same way. That maintains the problem. What I would say as a BCBA is we need to give them more time and stop jumping in so quickly. They know this skill. Your takeaway for this scenario is that prompt dependence is about reducing prompts, increasing wait time, and reinforcing independence to get over that prompt dependency. All right, let's wrap this up. What we covered today is one of the most important skill sets you will use as an RBT. If you take one thing away, it's this. Prompting is not just helping, it's strategic helping. Remember, prompts are temporary. Independence is the goal. Prompt dependence is preventable. Your timing matters and your decisions matter. I want you to ask yourself during your next session, am I helping this learner become more independent or more dependent on me? This is a skill that takes practice. You won't get it perfect right away, and that's okay. But the more intentional you are, the better your learner will do. All right, great work today. Let's take what we learned and start applying it to session. Thanks for joining.